Hi, I'm Alisha Luman. I'm a dental hygienist. I have been practicing since 2010, and I am the creator of the Freehand Ring. The Freehand Ring is one size fits most, but I've found that for the most part on the smaller fingers it fits fine. And the great thing about it is the prongs on the ring are flexible, so if you just stretch them out a little bit, they will compensate to fit on larger fingers. For having the freehand rings, I would recommend having one for every instrument pack. You don't forget about it and then you're starting and you're like, oh, great, I need my freehand ring. If you share instruments with other hygienists, then you're sharing rings, but they're all in the instrument packs. If a hygienist only wants to have her own rings, then of course you can bag them separately and keep them in your operatory. It's however you want it, but I just think it's more convenient to have them in every instrument pack. The only other reason why you maybe wouldn't share a ring is if you had to stretch out the rings to compensate for a bigger finger to fit on. The freehand ring actually sits really nicely on your finger. The gloves actually help to kind of have it stick in place. The foam pad locks in tight onto the ring, so you'll never have a problem with that falling off. For the most part, when wearing the freehand ring, I recommend using it on your index finger of your non-working hand. The reason why I recommend using the index finger is it's closest to you, so it's easier to find and you're not looking for it sitting right in front of you. Although if you're more comfortable wearing it on a different finger, whatever is most comfortable with you, that's the beauty of the freehand ring is it's very flexible. So if you are more comfortable wearing it on a different finger, then go for it. When I'm removing the debris from the instrument tips onto the freehand ring foam insert, I like to use a little rolling or twisting technique. When I do that, it really kind of helps to remove all that debris in one little easy swoop. So the pads are disposable, the foam inserts are disposable, and you should be able to use one insert per patient. Even on an SRP, there's more than enough surface. I've created the size to be sufficient enough to where you have a lot of area to work with. Caring for the freehand ring is pretty simple. There's no special care, so you don't really have to go out of your way to do anything different. You're gonna treat it just like your instruments. When you're done with it, you leave it on your tray, you put it in the ultrasonic, bag it with your instruments or place it in the cassette. You can obviously bag it separately if you want to. I like to keep it with my instruments so it's right there when I need it when I open my pack. And then it can go into any kind of sterilizer, whether it's an autoclave or a Statum, even dry heat. It just can't exceed 500 degrees, which isn't a problem with what we use.